Hi everybody, this is Dr. Said again. I will be talking about the contents of the axilla today. As you can remember, in the last lecture I talked about the walls mainly of the wall and boundary of the axilla and mentioned the contents, and today I will elaborate on the contents of the axilla. Now before going into the detail of the contents, let's quickly review the boundary of the axilla. As we mentioned, axilla has an inlet which is bounded by the clavicle, the first rib, and the upper border of the scapula, which is the apex or the inlet of the axilla, which allows the structures to move from the neck to the upper limb. And then it has a base or floor which is formed by the skin of the armpit. In addition to apex and the base, it has four walls. The anterior wall is formed by the pectoralis major muscle, which is removed here. You can see the pectoralis minor muscle, which also contribute in the formation of anterior wall. And the posterior wall, here you can see the main contributor of the posterior wall, which is subscapularis muscle, along with the teres major and the latissimus dorsi muscle. That is the posterior wall. The lateral wall is again the narrow intertubercular sulcus, and then the medial wall is not very clear here because of the presence of the pec minor. If you remove the pectoralis minor, then it will be easy to see the upper thoracic wall along with the serratus anterior muscle that form the medial wall. Okay, so those are the walls and the boundaries of axilla. Now let's focus on the contents of the axilla. Okay. And excuse me. So the first content that we'll be talking about the axilla is the axillary artery. Okay, and axillary artery is here you see this is the first rib. So the lateral border of the first rib is the boundary of the inlet, the axillary inlet. So up to here, this artery is the subclavian artery. Once the subclavian artery crosses the lateral border of the first rib, now from here we call it, it changed its name to axillary artery because of its location in the axilla. Now from here, axillary artery continues all the way down, and here this is the teres major muscle. At the lower border of the teres major muscle, this same artery, it changed its name because of its position in the arm to the brachial artery. Okay, so the extent of axillary artery is from the outer border of the first rib all the way to the lower border of the teres major muscle. So this is the axillary artery. Okay, so for the purpose of description, the axillary artery itself is divided into three parts based on its relation with the pectoralis minor muscle. See, this is the pectoralis minor muscle. The part of the axillary artery which is proximal to the pectoralis minor muscle, that is considered as the first part of the axillary artery. And the second part of the axillary artery is the part of axillary artery that is posterior to the pectoralis minor muscle. And the part of the axillary artery that is distal to the pectoralis minor muscle, this part, is called the third part of the axillary artery. Okay, so three parts again: first part, second part, and third part, and they are divided according to their relation with the pectoralis minor muscle. Okay, now let's go to the axillary artery and its branches that we will need to know. So again, here you can see the subclavian artery. This line indicates the inlet of the axilla. So the subclavian artery, now after this line, as it enters the axilla, it becomes the axillary artery. Axillary artery continues all the way to the here. This black line marks the lower border of the teres major muscle. Okay, so this is the axillary artery. Now let's look at the branches. As I mentioned in the previous slide, when the pec minor was there, we said this part of the axillary artery, which is up to here actually. So that is the first part, and these two branches are within the second part here, and then from here to here is the third part of the axillary artery. Okay, so now look at the branches. This is a branch, and interestingly, the first part give away one branch, second part gives two branches, and third part gives three branches. So that is easy to remember. You see, the first part one branch, second part two branches, third part three branches. So this is relatively easy to remember. So this is the only branch. We said one branch from the first part. Excuse me. You see this artery here, the superior thoracic artery. This artery comes from the part of the axillary artery which we consider first part, that is proximal to the attachment of the pectoralis minor muscle. Okay, so one branch from the first part, which is superior thoracic artery, and this attachment of the pec minor will be like this from here to here, and you can see two branches of axillary artery coming out from this particular area, which is second part of the axillary artery. They are the thoracoacromial artery and the lateral thoracic artery. Now, if you look at the thoracoacromial artery, it has a short stem. So after coming out from the axillary artery, specifically the second part of the axillary artery, it quickly divides into four branches. So those four branches are named according to the direction they are going. Okay, so this branch is heading towards the so this is the head of the humerus. So this branch is heading towards the deltoid. Deltoid is attached here. So this is called the deltoid branch. And this branch is heading towards acromion. So this is the acromion of the scapula. Now this branch is heading towards the acromion. So we call it acromial branch. Now this branch is clavicle is around here. So this branch is heading towards the clavicle. We call it clavicular branch. And this one is going towards the pectoralis major and pectoralis minor muscle. We call it pectoral branch. Okay, again, thoracoacromial artery has a short stem, and it quickly divides into four branches: deltoid, acromial, clavicular, and pectoral. Okay, and the second branch of the second part of the axillary artery is this one, the lateral thoracic artery. You see there are a lot of artery branches here, so I put stars on those. So just you need to remember the ones that has this red star close to them. Okay, so these are the two branches again, thoracoacromial artery and lateral thoracic artery. And then this is the end of pec minor muscle. So this branch is coming from the third part of the axillary artery, and you can see there are three branches, this one and this one and this one. Okay, so the largest branch of the axillary artery come out of the third part, which is subscapular artery. Look at the subscapular artery here. And then one of the branch of subscapular artery is circumflex scapular artery that goes to the posterior scapular region. And you remember this one leave the axilla to go to the posterior scapular region through the triangular space. Okay, so and the other branch of the subscapular is thoracodorsal artery. So subscapular, again the largest branch of the axillary artery, divides into two terminal branches: circumflex scapular artery, which leave the axilla through the triangular space to go to the posterior scapular region, and thoracodorsal artery that goes down in this direction. And then two other branches, they go either anterior to the head of the humerus or posterior to the head of the humerus. They go around the surgical neck of the humerus. Okay, the one in the anterior direction is called the anterior circumflex humeral artery, this one, anterior circumflex humeral. And the relatively bigger one is the posterior circumflex humeral. Posterior circumflex humeral also, you see, going to the posterior scapular region, and it leaves the axilla through the quadrangular space, right? The posterior circumflex humeral artery along with the axillary nerve. And then these two arteries, the anterior circumflex humeral and posterior circumflex humeral, they go around the surgical neck of the humerus and anastomose with each other. So these are three branches again. And now if we quickly review the axillary artery, we'll say axillary artery is the continuation of the subclavian artery. It changed its name at the outer border of the first rib, which is marked by this line. And then as axillary artery goes down, it gives several branches. For the purpose of this description, we divide the axillary artery into three parts based on its relation with the pec minor muscle, which is attached like this. And the part proximal to is the first. The part posterior to the pec minor is the second part, and the part distal to the pec minor's attachment is the third part. One branch from the first, again, superior thoracic artery. Two branch from the second part, thoracoacromial artery and lateral thoracic artery. And three branch from the third part, subscapular artery, anterior circumflex humeral artery, and posterior circumflex humeral artery. Now all these branches together, they supply the axilla, the walls of the axilla, and the surrounding spaces. Okay, so unlike nerves, so for the nerve supply of the muscle, we want to know the specific nerve that supply a particular muscle. But for the arteries, you don't have to know exact area, very specific area of the artery that supplies some area. But so, for example, we say this part, this superior thoracic artery, will supply the medial part of the medial wall and anterior wall of the axillary artery. And as a whole, we say axillary artery will provide blood supply to the walls of the axilla, the contents, the muscle that form the walls of the axilla and the surrounding area. I think that type of understanding will be enough for you. Now, excuse me. Now, axillary vein. Axillary vein and its tributaries are another major content of the axilla. And as you can see here, so these are the two superficial veins. If you remember, this is the cephalic vein that remains superficial all the way up to here to the shoulder region, where it pierces the deep fascia here. We call it clavipectoral fascia, and drain into the axillary vein. So one of the tributary to the axillary vein is the cephalic vein. Okay, and all other branches, the branches that axillary artery will give, the axillary vein will have those corresponding branches with the tributaries with the corresponding name. Like you see the anterior circumflex artery here, and the one going posterior is the posterior circumflex artery. Similarly, this one is in anterior direction, which follows the anterior circumflex artery. We call it anterior circumflex vein, and the one follow the posterior circumflex artery. We call it posterior circumflex vein. So when we talk about the tributaries of the axillary vein, we say it's a cephalic vein and the corresponding branches of the axillary artery. Okay, and so this is the basilic vein, but unlike cephalic vein, basilic vein doesn't go all the way up to the shoulder region. Instead, it dives deep and pierces the deep fascia of the lower or midarm and continue as a deep vein. And at the lower border of the teres major, this continues as an axillary vein. So it's opposite. So the subclavian artery changes its name to the axillary and goes all the way to the lower border of the teres major muscle. The axillary vein will go in the opposite direction, right? So the continuation of the basilic vein will form the axillary vein, and you can see the brachial veins, they are also a tributary to the axillary vein. So axillary vein keep going up next to the axillary artery, traveling through the axilla, and at the axillary inlet, it will continue as a subclavian vein. Okay, so those are the tributaries of the axillary vein. And now let's go to the lymph nodes. Axillary lymph nodes are important, but one thing is that I'm pretty sure Dr. Davis will elaborate on the axillary lymph node when he will talk about the lymphatic drainage of the breast. Okay, but because they are content of the axilla, so I will mention those lymph nodes just as a summary. So the lymph nodes are arranged, the axillary lymph nodes are arranged in 5 groups. Okay, and they are named according to their location in the axilla. So you see, this shows the outline of the axilla. Okay, this is the apex or inlet of the axilla, also called cervico-axillary canal. So this is the base of the axilla. This is the lateral wall, right? So now, see, look at this one here. This lymph node located here are called humeral because of their close relation to the humerus, and also because they are laterally positioned, they are also called lateral nodes. The pectoral nodes lie along the lower border of the pec minor muscle, and because of their location, they are also called the anterior nodes of the axillary group of lymph nodes. Okay, and then close to the posterior wall, which is formed mainly by subscapularis muscle, this group of lymph nodes are called subscapular lymph nodes or the posterior lymph nodes. Okay, so the lateral, anterior, and posterior. Okay, all these 3 groups will eventually drain in the central nodes. Central nodes are buried in the fat of the axilla, about the central portion of the axilla. So central nodes receive lymph from all these 3 group of nodes, and their different vessels go to the apical nodes. Okay, so from apical node it goes to the supraclavicular node, again depending on their relation on the clavicle. Okay, and different vessels, different lymphatic vessels from the apical nodes and the supraclavicular nodes, they join together to form the subclavian lymphatic trunk. Now, subclavian lymphatic trunk eventually will join the venous system. You see, lymphatics at some point they will all go into the venous system. but their subclavian lymphatic trunk, their ending in the venous system is little different on depending on which side you are talking about. On the right side, they generally join the venous system at the junction of the interjugular vein and the subclavian vein, but on the left side, they generally join directly the thoracic duct. Okay. Again, there are 5 groups of lymph nodes. They are named according to their location in the axilla. Again, they are lateral nodes, the anterior nodes, the posterior nodes. They all converge into central nodes. Central nodes drain into the apical nodes that via the supraclavicular node, they form the subclavian lymphatic trunk, and eventually they drain into the venous system. So that's all we need to know at this point about the lymph nodes. As I said, Dr. Davis will elaborate on the axillary lymph node because they are very important, because they drain about 75% of the lymphatics from the breast is drained through the axillary lymph nodes. Okay, so the breast cancer is pretty common. That's why that make it very important. Okay. Now, another very important content of the axilla is the brachial plexus. Okay, so the brachial plexus is a nerve plexus. Okay, and this plexus is formed by the branching network of intersecting nerves. So any plexus, wherever you see a nerve plexus, they are formed by the interconnected, the several nerves joined together, and they divide, they join back again, and eventually they form new nerves with the contribution from the different sources for a specific target. And you will see when we talk about the brachial plexus, you will see how that happens. Okay, and remember, this is a brachial plexus is a somatic plexus, so it doesn't have any autonomic component. Okay, so it's somatic plexus. Eventually you will know what is the difference between somatic and autonomic. If you don't know already, eventually we'll cover those things as well. So now let's see how brachial plexus is formed. Now let's make sure one thing. We are talking about the contents of the axilla, right? Now this part of the brachial plexus we are talking about today, but you see, if you look at the location, this is the clavicle here, right? This is the first rib here. So anything above that area, above the apex of the axilla, cannot be considered a content of the axilla, right? But as we are talking about the brachial plexus, we will talk about the brachial plexus as a whole. But remember, this part of the brachial plexus is not within the axilla. They are located in the neck. Okay, so any part beyond this is actually the part of the brachial plexus that is contained within the axilla. Okay, so now how the brachial plexus is formed? We said this is a branching network of nerve formed by the union of several nerves, several spinal nerves. So these are the spinal nerves that contribute in the formation of brachial plexus: the C5, cervical 5, C6, C7, C8, and T1, thoracic 1. So these 5, and these are not the whole spinal nerve. I know, I'm pretty sure you know about the formation of spinal nerve. Spinal nerve is formed by the dorsal rootlets and ventral rootlets, and they immediately, after spinal nerve is formed, they immediately divide into 2 divisions, the dorsal rami and the ventral rami. Dorsal rami goes to the back, and they supply the deep back muscle and the skin overlying the deep back muscle. That's all dorsal rami will do. So don't worry about dorsal rami. All you need to know about dorsal rami, which is one of the branches of the spinal nerve, will provide nerve supply to the deep back muscle and skin overlying the back. All other functions are carried out by the ventral rami. Okay. Now again, a brachial plexus is also formed by C5, C6, C7, C8, and T1, and these are not the whole spinal nerve. They are only the ventral rami of the spinal nerves. These 5 spinal nerves, and they are called the root of the brachial plexus. Okay, so what are the root of the brachial plexus? Again, the ventral rami of the spinal nerve: C5, C6, C7, C8, and T1. Okay, and then of course they are located in the neck. Okay, now these roots, so C5 and C6 join together to form the trunk, one of the trunk of the brachial plexus, which is the superior trunk. Okay, now C7, which is a root, it continues itself as a middle trunk. Okay, and C8 and T1 will join together to form the inferior trunk of the brachial plexus. So we have 5 roots, and then they join together to form 3 trunks. Again, superior trunk formed by C5 and C6, Middle trunk is C7 itself, and C8 and T1 will form the inferior trunk. Again, these trunks are also located in the neck. Then these trunks, each trunk, which three trunks, right? Superior, middle, and inferior. Each trunk then divide into an anterior division and posterior division. Look at anterior division and posterior division. The inferior trunk, you cannot see the posterior division very well because this is behind the axillary artery, but you can see the anterior division of it. Okay. Now, then we have 6 divisions, right? 3 anterior division and 6 posterior division. Each trunk is dividing into 2 divisions. Now, anterior division of this one and this one will join together to form this lateral cord of the brachial plexus. Okay. Now, anterior trunk of the anterior division of the inferior trunk will continue as a medial cord. Okay, so the lateral cord is formed by the anterior division of 2, but the anterior division of the inferior trunk itself will continue as a medial cord. So we have a lateral cord, we have a medial cord, and the posterior division of all 3 trunks will join together to form the posterior trunk that is not visible here because they lie posterior to the axillary artery. So axillary artery is here. If you see very carefully the nerve that you see behind the posterior to the axillary artery, that is the posterior trunk. So now posterior trunk is formed by the posterior division of all 3 trunks. And the anterior divisions of the 3 trunks will form 2 cords. One is the lateral cord, other one is the medial cord. So 3 cords again, the lateral cord, medial cord, and posterior cord. Okay, they are named according to their relation with the axillary artery that I will show you in the later slide. Now, the cords are important for us today because the cords will give most of the terminal branches of the brachial plexus. That's one thing important, and also they are located in the axilla. When you see the dissection of the axilla, you should be able to identify the terminal branches that are coming mainly from the cords. You will not see the branches coming from the roots or the trunks because they are in the neck, they are not in the axilla. Now, but still there are some branch come from the root. Now, 2 branches that come from the root, one is dorsal scapular artery. Okay, now look at this one, dorsal scapular artery. It's coming from just from C5. Okay, and now the contribution from, and the long thoracic artery is another branch from the roots. Now look at this one. So C5, C6, C7, they all, give a contribution to form the long thoracic nerve. See, it's formed by C5 to C7. So that is the long thoracic nerve, which is a branch of the root. So again, 2 branches coming from the root. One is dorsal scapular nerve, which is only from C5. And C5, C6, and C7 contribution will join together, give a small branch. All 3 small branches join together to form a long thoracic nerve, which is a branch of the root. Now, let's see if there are branches coming from the trunk. Now, these are the trunks, right? 3 trunks. We have superior trunk, middle trunk, and inferior trunk. Now, look at this one, the suprascapular nerve. You are familiar with the suprascapular nerve because it was the nerve that provided nerve supply to the supraspinatus muscle. That is coming from the superior trunk, and also the nerve to the subclavius. There is a small muscle lies just underneath the clavicle called subclavius. So those 2 nerves are branches coming from the trunk. Okay, again, suprascapular and the nerve to the subclavius. These are the 2 branches coming from the trunk of the brachial plexus. Now, there are no branches coming from the division again. So, and this is again, it's just to make it easy, this cartoon, so that you can see all the roots of the brachial plexus, and then they form trunks. Trunks divide into divisions. Divisions again join together to form cords, and the cords eventually will give all the terminal branches. We'll look at the terminal branches in the next slide. Now, so we said there are 3 cords of the brachial plexus, and why the cords are most important for us today? Because the cords are the parts of the brachial plexus that is located within the axilla. So this is the axilla, right? And you can see the lateral cord and medial cord, and posterior cord you cannot see because of the presence of axillary artery. This part is the root and the trunks. As you can see, this is the neck, not the axilla, right? So the roots and trunks of the brachial plexus are located in the neck. The cords of the brachial plexus are located within the axilla. Now, how we name these cords, the lateral, medial, and when we say medial or lateral, they are in relation to something, right? So here, the lateral cord, medial cord, and posterior cord, they are named according to the relation of the axillary artery. So this is the axillary artery here, right? Now, this cord of the brachial plexus lies lateral to the axillary artery, hence it is called the lateral cord. This is medial to the axillary artery, we call it medial cord, and this is the posterior to the axillary artery, we call it posterior cord. That's the reason you can see the lateral to the axillary artery, lateral cord, medial to the axillary artery, medial cord, you can see them, but posterior to the axillary artery you cannot see it because it is hidden by the axillary artery, right? Now, let's go to the branches of the cords of the brachial plexus, and also I forgot to mention that the cords are important for one more reason. Not only they are located in the axilla, also most of the terminal branches of the brachial plexus come out of the cords of the brachial plexus. Now, to find the branches of the terminal branches of the cords, we usually use an M pattern. Actually, we try to find the M in the brachial plexus, and that make it easier for us to find the branches. So how M is formed? So this is the M, okay? So this part of the M, you see, this is the lateral cord, right? So lateral cord is dividing into two branches. One is the musculocutaneous nerve, which is a terminal branch of the lateral cord. And you can see this is not a nerve by itself, but it is contribution. It is giving contribution for a formation of this nerve, right? This nerve is not formed completely by this one, but this one and this one join together to form this one. This is the median nerve, which is formed by the contribution from the lateral cord and medial cord. So this is the contribution of the lateral cord in the formation of median nerve, and this is the contribution of the medial cord in the formation of median nerve. So median nerve is formed by the contribution from both medial cord and lateral cord. That's how M is formed. So this part of the M is coming from both cords, okay? And this is another terminal branch of the medial cord, and this nerve is the ulnar nerve, okay? So again, if we go back to lateral cord, its terminal branches are musculocutaneous nerve and contribution to the median nerve. And medial cord, its terminal branches are ulnar nerve and its contribution to the median nerve. Okay, so ulnar nerve, again, you can see it is formed solely by the medial cord. Musculocutaneous formed solely by the lateral cord, but median nerve is formed by the contribution from both lateral cord and medial cord. Okay, now there are some other branches of the cords as well. What are the other branches of the lateral cord? So in addition to the musculocutaneous and lateral root of the median nerve, it provides another branch, which is this one. Let me find where is this one. This is the lateral pectoral nerve, okay? Lateral pectoral nerve. Now, this lateral pectoral nerve is not named because it is lateral to something. This is named lateral pectoral nerve. It goes to the pectoral region, so it is called pectoral. Why lateral? Because it is coming from the lateral cord of the brachial plexus. So this is named lateral not because of its position, it is because of its origin. It is originating from the lateral cord, that's why it is called lateral, and pectoral because it is supplying the pectoralis major, pectoralis minor muscle and pectoralis major muscle. Okay. So these are the three branches of the lateral cord. Now let's move to the terminal branches of the medial cord. Again, we know these two branches of the medial cord. I mentioned about the ulnar nerve and the contribution of the medial, or we call it medial root of the ulnar nerve, okay, of the median nerve. Okay, so the medial pectoral nerve is here. You see, this one is coming from the medial cord. Again, this is not medial pectoral because of its location. This is called medial because of its origin from the medial cord. Okay, so the medial pectoral, a nerve coming from the medial cord going to the pectoral region. That's why it is medial pectoral nerve. Next one is medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm. There are two cutaneous nerves that will come from the medial cord. One will provide innervation to the skin of the arm. Other one will go down and provide innervation to the skin of the forearm. The one provide innervation to the arm, it is called the cutaneous nerve of the arm. And the one provide innervation to the forearm, it is called the cutaneous nerve of the forearm. Why medial at the beginning? Because both of them, they arise from the medial cord of the brachial plexus. Remember, they are not because it is medial to something. They are called medial. The medial in their name indicates that they are coming from the medial cord of the brachial plexus. Again, medial cutaneous nerve of the arm, and you will see two cutaneous nerves here. They will look exactly the same. We differentiate them by looking at their ending. If they end in the arm, we call it medial cutaneous nerve of the arm. If it goes all the way to the forearm, we call it medial cutaneous nerve of the forearm. Again, the name medial is because of its origin from the medial cord. Okay, and then its terminal branch is ulnar nerve. So again, if we summarize the branches of the medial cord, again, two cutaneous branches, one going to the arm, one going to the forearm. Because they are of their origin from the medial cord, they are called medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm. In addition, there is another one going to the pectoral region. Because of its origin from the medial cord, we call it medial pectoral nerves. In addition, it has two terminal branches. One is its contribution to the formation of median nerve, and another main terminal branch is the ulnar nerve. Okay, this is the ulnar nerve. So now, so we talked about the branches coming from the lateral cord and medial cord. Why we cannot see the posterior cord here? Because the posterior cord is called posterior cord because it lies posterior to the axillary artery. Okay, now in the next slide, if we remove the axillary artery from its position, then the posterior cord will be visible. Okay, so let's summarize them. They are the upper subscapular, middle subscapular is also called thoracodorsal, lower subscapular, or you can call superior subscapular, middle subscapular, inferior subscapular, axillary nerve, and radial nerve. Now both axillary and radial nerve both goes to the back of the arm, and the axillary nerve leave the posterior wall of the axilla through the quadrangular space and is accompanied by posterior circumflex humeral artery. Okay, and you can see in this position, axillary artery is very closely related to the surgical neck of the humerus. Okay, so any fracture in the surgical neck of the humerus may cause damage to the axillary nerve. So I hope that's all I have about the branch. So this one I just intentionally didn't level them. So you can level all of them. So that will be a good homework for you. So study the brachial plexus and then see what are the ventral rami of the spinal nerve that form the root of the brachial plexus that are indicated by 17, 18, 19, 20, and 21. Again, this is C5, 6, 7, 8, and T1. And these are the two branches coming from the root, and then they form three trunks, one trunk, two trunk, and three trunks. The trunks divide into anterior division and posterior division. All three posterior division join together to form the posterior cord. And this is the lateral cord, this is the medial cord. Now, lateral cord, again, lateral cord, medial cord, and posterior cord, they are named according to their relation to the axillary artery. So, position of the axillary artery will be around here. So, this one is behind the axillary artery or posterior to the axillary artery, we call it posterior cord. This one is lateral to the axillary artery, we call lateral cord. This one is medial to the axillary artery, we call medial cord. Again, if you see a branch coming from the medial, so these are the branches coming from the medial cord, we call them medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, because they are coming from the medial cord, not because they are medially positioned. Okay, so in most of the cases, like cords of the brachial plexus are named according to their relation of the axillary artery, but the lateral pectoral nerve, medial pectoral nerve, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, these are the ones named not because of their relative position, they are named according to their origin, which cord of the brachial plexus they are coming from. So just do your own study, and as I always said, if you have any question or concern, don't hesitate to contact me. You have my cell phone, you have my email. So whenever you need help, whatever type of help you need, don't hesitate to call me or contact me, whichever way it's convenient for you, or any other human structure faculty. We will try our best. We know it's difficult, the remote learning, it's stressful for you guys maybe, but we will try our best to make human structure a a pleasant experience for you. So thank you for listening. I will see you in the lab in the near future. Thank you.